16 days since the disaster declaration was signed, Congressman Madison Cawthorn held a roundtable to discuss federal action following deadly flooding from Fred.
It included workers from FEMA, the U.S. Department of Agriculture, the U.S. Small Business Association, and the North Carolina Department of Public Safety.
News 13's Hannah McKenzie has details.
The meeting was brief, just 35 minutes long. It is still available on YouTube. We've also got a link on our website, WLOS.com, if you'd like to watch. But the main takeaways from today's meeting were FEMA individual assistance, help for small businesses, and agricultural aid. Congressman Madison Cawthorn hosting a virtual flood assistance roundtable Thursday. The purpose, provide an update on federal assistance following the flooding caused by the remnants of Tropical Storm Fred.
Seeing so many people's lives literally uprooted and destroyed, it was devastating.
Fred hit western North Carolina on August 17th, leaving behind a path of destruction. The federal disaster declaration was signed on September 8th. Since then, John Boyle says FEMA has been hard at work.
We have approved $1.58 million for 318 households in Buncombe, Haywood, and Transylvania counties.
For businesses struggling to get back on their feet, Kathy Cook says the Small Business Administration provides low-interest, long-term disaster loans for costs not covered by insurance or FEMA.
You're eligible for a disaster loan for up to $2 million or up to the limit of your physical damages and your economic injury, regardless of what size of business you are.
Programs also being offered to farmers. Rob Satterfield with the USDA highlighting a few. The Emergency Conservation Program, the most frequently utilized, he says.
That provides cost share assistance to remove debris from cropland and farm roads, restore permanent fences, to grade, shape, re-level cropland that's been damaged, and restore conservation structures that have been damaged. It pays approximately 75% of the cost of repairing this damage.
Roundtable viewers were encouraged to ask questions. Comments during Facebook live streams are not saved, but we rolled on several that went unanswered, including our own. We asked about criticism the congressman has received about his handling of the response to flooding. Because many of our questions didn't get answered, I've sent them over to Cawthorn's office. We're awaiting a response.
2 board members of HCA-owned Transylvania Regional Hospital have resigned. They cited major concerns about the hospital's future under the for-profit company.
News 13's Kimberly King has more on their letter and what a local councilwoman plans to do.
Posted here in Brevard in the local paper, Councilwoman Maureen Kopoloff has emailed Transylvania Regional's president asking for a meeting to ask if HCA wants to sell.
Maureen, the fact that these 2 board members have basically said they have no faith in HCA for your local community, do you think this is a turning point for your community here?
Yes, I do.
Councilwoman Maureen Kopoloff knows both Mark Weinstein and Parker Platt, the 2 serving on the Transylvania Regional Board 10 years, stating in their open letter, "We were both enthusiastic about the sale to Mission and subsequent sale to HCA. To say the reality of the current situation is a disappointment to us is an understatement. It's clear the board has no ability to play any kind of impactful role, from the essentials of staff to the mass exodus of our physicians." Kopoloff says their statement could be a turning point for frank talk.
But now I think we really need to start asking the question directly to HCA. Do you really want to continue to have a hospital in our community, or opening discussions about selling it?
Weinstein, president of the Brevard Music Center, and Platt, president of Platt Architecture, go on to say, "It appears the board is simply around because it's required to be and serves as a rubber stamp for quality and credential reports prepared by others. In our judgment, the very nature of a for-profit-based hospital in Transylvania County is in serious question." Kopoloff serves as Brevard Council's liaison to HCA. We watched as she composed a letter to hospital president Michelle Pylon, calling for a meeting to know if HCA is going to commit to the rural hospital.
Do you have a message to the administrators at HCA?
I would like them to either firmly commit to running this hospital and providing quality care. If they're not willing to do that, then to open negotiations and look at finding somebody who does want to be really concerned about rural health care in a community.
News 13 Investigates reporter Karen Zakalak broke the news this summer that 14 doctors here at Transylvania Regional had left the hospital after HCA took over. Reporting from Brevard, Kimberly King, News 13.
A short time ago, we received a statement from Mission HCA. They did not respond to whether the company would consider selling off Transylvania Regional.
Now, the statement in part thanks the two board members for their service. It also says our community can be confident that we have an excellent hospital here to care for them. We continue to invest in bringing new services. Now, you can see the full statement at WLOS.com.
It may be possible for urban renewal descendants to get more than an apology from Asheville.
We told you that the city has established a reparations fund. Tonight, News 13's Ty Russell wraps up his three-part investigation into how urban renewal displaced black families.
He's asking the mayor how the money may be used and what the city is doing to avoid repeating past mistakes.
How is this considered reparations?
For most people, that probably means a cash payment. Cities are limited. Cities cannot make cash payments to individuals in this way that some people think of as reparations. But what cities can do is adopt policies and implement programs that address past harms.
Asheville Mayor Esther Manheimer says that includes new efforts to increase housing, business growth, and development in the minority community, which may include grants to put toward a home or business. Now, this push comes after the city apologized for urban renewal programs that displaced black families, some of whom moved to public housing. What is the city doing to make sure this reparations plan is not a repeat of those policies that ended up doing more harm than good?
I think that's a really good question. And it's true anytime the city of Asheville embarks on a new program or expands a program or even reflects on existing programs, we're trying to make sure that we always implement and examine those programs with an equity lens.
What we're talking about, and I've asked that this so-called reparations be rebranded because the local governments don't have the budgetary wherewithal nor other wherewithal to render reparations.
Community leader Dee Williams wants to make sure there's input from black leaders on future policies impacting minority families and business, especially once the city establishes its reparations commission.
A lot of times we've been the target of these things without having any pertinent input also. And so that's been a grave mistake.
She is currently the incoming interim director of the Eagles Wings Community Development Corporation. It's a group working to increase permanently affordable housing and boost black business. Williams also believes crime means poverty and a lack of opportunity. So she is pushing for measures to permanently close the wealth gap.
We do not believe that perpetually operating with a handout and always looking for a grant is sustainable.
Evanston, Illinois is the first U.S. city to offer residents and descendants payments in its reparations plan. Those eligible can receive up to $25,000 to put toward housing. Evanston also has a fund that's replenished through its marijuana sales taxes. Now, Asheville first came up with its idea in July 2020, and so far it has a more than $2 million fund, and it's currently funded through land sales and developers. There's also a pause on selling land bought during urban renewal. And after more than a year of waiting, the next step is now to fill the seats of a commission. That's after a black-owned company that specializes in equity was hired to oversee it. It's also common for cities to cough up cash and hire consultants and researchers for large projects. And now finally, a plan may be in front of council sometime next year or in 2023. How do you see this process playing out at the end? How do you see that? How does it look to you?
Well, again, being one of the first communities to do this, it's not entirely known how it will look in the end, so to speak. But I am also hopeful that there are permanent changes in how we as a city deliver services to our community.
In a statement to me, the city manager says the commission will consist of people from Buncombe County and the city. And if you feel like there's not enough community engagement right now, she says that will greatly increase once the commission has been formed.